Hi, everyone. My name is Punam Punja. I'm a PA at Emory Healthcare in Atlanta, Georgia. I've been practicing as a PA for over 15 years, primarily in general hepatology. Thank you for joining me. And my topic today will be type 2 diabetes and MASLD. So one of the questions we want to answer is that given the high prevalence, what is a practical and evidence-based approach for ongoing monitoring surveillance for MASLD and MASH development in patients already diagnosed with type 2 diabetes? So there's a bidirectional relationship between patients that have type 2 diabetes and MASLD. Oftentimes they occur together. There's approximately 70% of patients that have type 2 diabetes that also have MASLD. In May of this year, the American Diabetes Association recommends routine screening for liver fibrosis using a FIB-4 test. The FIB-4 test includes a patient's age, AST, ALT, and platelet count. You put it into the algorithm, and if it comes back less than 1.3, these patients are considered low risk of having advanced fibrosis. This should be done in any patients that have a history of prediabetes or have a diagnosis of type 2 diabetes at least every 1 to 2 years. The primary goal of screening is to identify individuals at risk for advanced fibrosis, since fibrosis stage is the strongest predictor of adverse liver-related outcomes in MASH. The ADA, MASLD, and EASL all recommend initial screening should focus on non-invasive tests like the FIB-4 test, regardless of a patient's liver enzyme or symptoms. And so you may be asking yourself, how often should we be assessing this FIB-4 test? So the FIB-4 test should be done every 1 to 2 years. If the FIB-4 comes back at 1.3 or greater in patients that are age 65 or less, these patients should then get a secondary risk assessment done either with a transient elastography test or an ELF test, which is a blood test. If patients are age 65 or greater, the FIB-4 cutoff is actually 2. Earlier reassessment needs to be done in this patient population that has type 2 diabetes if they have new or worsening clinical features of their liver disease, if they have unexplained increase in their liver enzymes, if they have significant weight gain, or they develop another cardiometabolic risk factor, you may want to reassess these patients earlier. Clinical judgment should guide more frequent testing. So should we be checking liver enzymes in these patients or just be monitoring non-invasive tests? So because non-invasive testing is done every 1 to 2 years, the liver enzymes are already being checked during this time. Liver enzymes can be normal in patients that have MASLD and MASH, so it doesn't really help or guide you to let you know if patients have progression in their underlying liver disease. The normal ALT level for a male should be about 35 or below, and for a female should be about 25 and below. You may be able to check liver enzymes sooner if patients are planning to start medications that could affect their liver enzymes, or if they have significantly elevated liver enzymes, you could check it earlier, maybe in 3 to 6 months. So how can APPs leverage the type 2 diabetes care setting to integrate patient education about MASH risk and the importance of lifestyle interventions for liver health? So unlike yearly screening for eye and foot exams, liver health has not been at the forefront of patients with type 2 diabetes. MASH is a silent disease, so it's important to educate patients about lifestyle changes because unlike diabetic retinopathy and diabetic neuropathy, patients that have MASH with fibrosis is reversible and can resolve. You need to educate your patients about FIB-4 testing. This can be done even with them using a calculator, and let their primary care provider know if the FIB-4 starts increasing to prompt earlier intervention. October is National Liver Awareness Month, so it's a perfect time to start educating patients now. It's our job to make a complex liver condition like MASLD, MASH easier for patients to understand, manage, and face with confidence. Thank you. And for any more information, please visit the GAP MASLD Community Network. Thank you.